What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for April 2, 2021. Where are we in the pandemic? Friday Q&A with Dr. Jennifer NUZZO. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, for a Friday Q&A episode, I catch up with Jennifer NUZZO, Senior Scholar at the Center for Health Security at Johns Hopkins. Let's listen. Jennifer NUZZO, thank you so much for coming back to Public Health on Call. It's been a while since your first time on the podcast.
It has. Thanks for having me back.
I think you were a guest in our very first week. So I have some questions for you like I did back then, an entire year ago. First is the epidemiology of where we are now. I think it'd be fair to say we are seeing some mixed signals. There are some places where the cases are actually rising. There's concern over variants. Other people are pretty optimistic, though, about the rapid pace of the vaccination campaign. Where do you think we're headed in the short term?
I think it's a mixed signal, and it really is a mixed signal depending in part where you live. And it seems like the biggest factor determining what the signal is saying is the rollout of the vaccine and how far along a country is and how many vaccines they have access to. So globally, we are unfortunately, again, seeing a rise in cases after having seen a global decline in cases. This is obviously not very welcome news, and there are some parts of the world in particular that we're worried about. Europe is headed into some tough situations now. India, cases are rising again. Brazil, obviously quite worrisome. As for the US, I'm a bit more optimistic. Case numbers had been declining. They're a bit of a plateau now. My hope is that we will continue to see stepwise declines in cases in the US. There are a few things that complicate that hope. One being that, it seems like a number of states have just basically declared the pandemic over and are lifting all manner of restriction, including most egregiously mask mandates. We also know that there's been a fair amount of travel around spring break, which, if you've seen some of the footage from Miami, Florida, was quite a worrisome situation. In my view, it is far too early to have that kind of gathering. But I think the United States, compared to other parts of the world, is in better circumstances because we have so much vaccine and because we are allocating vaccines, really at, quite a clip. I am hopeful that we will not see the same kind of surge in cases that we saw over the holidays. But, it's anything's possible at this point. And it is possible for the virus to spread faster than our vaccination efforts. So it is my hope that we will continue to stay the course so that we don't see that happening.
It's been hard for people to get the message that they can do a little bit more and not go all the way to the pandemic is over. Finding that middle gear has been difficult, and you get pictures like spring break.
Yeah, I get it. We're a year into this fully, and everybody is tired. And when you hear about case numbers declining, it's I think good to feel optimistic because of that, but we don't want optimism to translate into making the wrong choices.
So what are the key steps of controlling the virus now? Obviously, vaccinating is super important. Is that the only thing on the list?
No, it's all the measures that we've been using since a year ago. And, it starts with if you have any symptoms or you've been exposed to somebody, possibly if you've been involved in some kind of high risk activity like a spring break party in another state, it's probably a good idea to see about getting tested so that if you are infected, we can make sure you stay home until you're no longer contagious so you don't spread the virus onto others, people you may have exposed if you are positive. also should be notified, and ideally they should stay home until we know for sure they're not contagious. So those measures are still important. Masking, keeping physical distance, trying to avoid crowded indoor spaces, particularly crowded indoor spaces where mask use may be, inconsistent, like, restaurants and bars are riskier just for that reason. All of those things remain important and will remain important until the majority of us are protected with vaccine.
What about what's important from the community perspective? Like, for example, testing. What's the role of testing now, and what kind of testing resources should communities have available?
Yeah, there's really kind of two ways that we look at testing. One is the way that I already described, which is it's the tool that tells you if you're infected, and the tool that gives you a result that tells you that you should stay home until you're no longer contagious. So that's just really important for interrupting transmission, finding the people who are infected and getting them to stay home so that they don't transmit it to others. But testing is also how we conduct our surveillance. It's how we understand, where the virus is, where it isn't, who is getting it and who isn't, and if there are any changing patterns that may signify a worrisome new direction, say perhaps the emergence of a new variant that has increased transmissibility. It all starts with understanding where the infections are. And then once we look at trends that seem concerning, we can drill down more deeply to try to figure out what's causing those trends. And that can give us a signal like, if we sequence the virus and find that there is a variant that's doing things we don't want it to do, but we can't do that until we know who's infected in the first place. And that's what testing does.
So are we testing the right amount now? Do you think we need to expand different kinds of testing?
So it seems like we've taken a bit of a worrisome turn with testing. So for the last month, we've noticed about a 24% decline in the number of tests performed each day. Now, that by itself may not be worrisome because we know that cases have also declined during this time period. But what makes me worried about it is that I saw testing starting to stagnate around the end of November, around Thanksgiving. And really, if you remember what happened after Thanksgiving is that we headed into one of the biggest surges that the U.S. has ever seen. And, record case numbers being reported each day. And testing never really scaled to meet that surge of cases. It didn't really scale with the surge of cases. It really just kind of plateaued. And then in the last month, again, we saw this kind of precipitous drop. So because that's happened, that really makes me worry that we are scaling back on testing to do something else. And, that plateau of testing actually corresponds to when states really started getting ready to roll out vaccines. And we've now heard from a number of states saying that they basically had to pivot from testing to vaccines, in some cases actually converting mass vaccination centers into mass testing centers. So it suggests that it's possibly driven by limited bandwidth rather than limited need for testing. And that just always makes me worried that we are starting to miss things, that we may be having some blind spots in our surveillance if we're just pulling back on testing prematurely because we don't have enough resources to do it.
Got it. I think you meant they converted the testing centers into vaccine centers.
Yes, converted mass testing to vaccines.
So perhaps with some of the funds that were in the rescue plan, that we'll start to see a shoring up the testing capacity of this country.
That's my hope. I mean, there is money in the recent bill that was passed, which I hope can do it. Now, of course, probably what's limited is people, and it's harder to make people to do this work. Testing, like vaccination, is a clinical encounter, and so we do need people who are able to do that, but it's a good start for sure. And I just hope that it proceeds quickly enough, because even a month gap in our testing efforts could create considerable blind spots in our surveillance.
Got it. I want to talk about children. I know you've been thinking about children in the pandemic for a very long time, since the pandemic started. And you and I wrote a piece last year saying that we should close the bars and open the schools at a certain point. Now, in a lot of places, the bars are open and the schools are starting to open. What do you think the future is for kids? And maybe if you could comment on the recent CDC decision to say the 3 feet of distancing with masks is okay.
So I'm hopeful the situation for children will start to get better. It feels sort of frustrating, the progress at which we are making to return kids to schools. I mean, it still very much feels like in many states, returning children to school is the last priority, in that we are seeing all sorts of things opening before children are able to return to the classrooms for full in-person instruction. But, I think there have been some developments that hopefully will make it easier to return children to school full time. One is that, teachers are increasingly identified as a priority for vaccination, and that obviously adds a level of safety to the classroom that we just didn't have, 6 months ago. The other development is that the CDC just issued new guidance that said that a strict adherence to a 6-foot distance between children may not be necessary if other safety measures are in place, crucially masking, but other measures such as cohorting, limiting the number of people who have contact with each other on any given day. And that's really important development because for many schools, the final barrier to returning children to in-person instruction was just simply not having enough space to make that 6-foot guideline work. And that's one of the main reasons why school districts have pursued hybrid education, where they bring in, half of a class back at a time so that they can space the children out. I think increasingly we've learned that is probably not necessary if the other measures are in place, and that will hopefully allow more children to return to the classroom full time.
Got it. I want to ask you about the vaccine. What are you looking for with all this data that people can find on the Johns Hopkins dashboard, all these different stories? Today's the highest Tuesday, we've ever had. What are the key things you're looking for to sort of measure the effectiveness of the vaccine rollout?
It's really about, for me, coverage, and not just coverage in terms of absolute percentages of the population, but whether we're reaching all the people we need to reach. And that's been one of the hard things as we've put a priority on, numbers of vaccines given in a particular day, speed. Obviously, speed is incredibly important, but not if speed comes at the cost of leaving certain groups completely behind. So for me, is the coverage happening? Are we actually getting the vaccines into arms, and are we doing so with respect to need? And unfortunately, I think in a number of states, the number of vaccinations may be high, but there are huge disparities in who's been able to get the vaccine and who hasn't. And for me, it's a question of access and whether we're creating enough of an infrastructure and options for people to get vaccinated such that we can make sure that we adequately cover our communities.
So it's very good news that we're seeing so many people vaccinated, but you're also looking to see who's getting vaccinated and whether people are being left behind in particularly in areas where there has been a lot of COVID.
Absolutely. I mean, I was asked once sort of pejoratively, like, do we really care about equity? Isn't it just about getting it into arms and assuming that the arms will all add up to a level of protection? And unfortunately, that's not true. I mean, we have actually seen disparities. We don't all interact with the same, at the same levels. And, there are concerns that if you just leave whole pockets of states uncovered, that, the state itself is going to continue to see possibly deadly spread. So it really is important, both from a moral issue, but, an epidemiologic issue, to make sure we have full coverage in all of our communities.
So May 1st, big day for vaccines. By then, we understand that anyone will be able to sign up, not necessarily be vaccinated, but sign up. What do you think some of the advantages of setting that goal date are for the system of delivering vaccines?
Yeah, I mean, it's an ambitious goal. It was a date put out there in part to signal confidence in the vaccine supply, which has been an important constraint in getting vaccines into arms. I think, I've heard about, states, saying we can do more. We just need more vaccines to be able to administer. So I think that's important to set that very clear expectation that we will have sufficient doses for any adult who wants to be vaccinated. That's great. But whether you will be able to get the vaccine into your arm on or around May 1st is really going to depend on how ready your state is and how ready they are to be able to handle that kind of volume of vaccinations. So it is also a direct challenge to the states to get ready. And, in my view, if we're going to get there in, just over a month's time, we are really going to have to step it up on all fronts. I mean, it's going to be more providers, more hours, the kind of 9 to 5 vaccination schedule is probably not going to cut it. We need to have, kind of all hands on deck, really, particularly to make sure we don't leave communities behind and that we can take vaccine to the people who can't otherwise come to it. So it is quite a challenge. So whether you're going to get it, I think is going to depend a lot on your state. And hopefully states are using the resources that are now going to be coming to them and this next month or so to get ready for it. Because I think once there is the expectation, it will be hard for them to not meet that expectation.
Yeah, I think that was one of the benefits of setting a goal like this. It's basically sending a signal that it's time to get ready for a lot of vaccine coming your way.
Yeah, and it's fortunately not the winter anymore. I know heard about a lot of vaccine clinics being canceled for even light snow, but we can't afford to have conditions delay the vaccine unnecessarily.
Well, thank you for joining me. This has been great to catch up on a whole bunch of things, and good luck with all of your great work for the Johns Hopkins site and everything else that you're doing.
Thanks so much. I appreciate it.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.